Is the favorite digital lady pharmacist, Julia Chinello from Pharmarbiter. Once more, you are welcome to my YouTube channel. If it is your first time here, what we discuss basically is issue around health and your right to one. At the same time, we advocate for victims of medical malpractice, negligence, and exploitations, and we provide them that forum to come up, to speak up. So please do subscribe, hitting the subscription button, and if you have been here with us, if you have stick with us all the while, we say awesome thanks. Thank you for all the support. We appreciate all that. You guys are simply awesome. You know, you are simply the reason why we keep rolling out these videos every Wednesday. Thank you so much, and keep the thumbs up and the comments coming. Okay, I'll wear my professional face now. So for a while now, for the past couple of weeks, we've been talking about insomnia, sleeplessness, causes and triggers, down to consequences of sleep deprivation, and we thought we are done with that, but someone popped up a question that we have to come up with this video today. And that question is, what if the medication you are taking to manage a lifetime ailment is responsible for your lack of sleep? So the essence of this video is to provide you with counter actions on how to work around it, to address it, so that you manage your older disease condition as well, and at the same time catch some sleep. So we are going to be discussing 8 major classes of medication that can cause insomnia alongside it, and also feel free, if you notice that a medication you are taking within cover it and you feel it could be causing you insomnia, hop on the comment section and let us know the drug, and we would answer you if it has got a tendency of causing you insomnia. And also, if you want to go private, we've got a website, www.pharmarbiter.com. just pop onto our homepage and click on report your medical audio and fill out the form and the question that will come to us, and one of our healthcare professionals within Pharmarbiter's medical bubble will hop onto that and answer you. So back to the topic of the day. The number one class of medication that could cause you insomnia is the antidepressant. Antidepressants are a class of medication that are used to manage depression. And the typical example that we'll be talking about today is the selective serotonin reuptake inhibitors, fluoxetine, Prozac. This class of medication can cause sleep impairment because it increases the level of serotonin in the brain, which interferes with sleep in most people. And what counter action can you take? If you are taking fluoxetine a once daily dose, you can work it out with your healthcare provider to see if you can take this medication in the morning hours, so before evening the metabolism and the half-life and the quantity that will be left in your bloodstream will be minimal, and the tendency of it causing you your sleep at nights will equally reduce. Or alternatively, you can opt for a total swap of medication to antidepressant that have a reduced tendency of causing insomnia. Example are the trazodone, the mirtazapine. Any of these two could be a good swap. And the number 2, stimulants. Stimulants mustn't necessarily come in form of medications. They can be alcohol, your regular coffee, or caffeinated drinks you take. But to drag our point home today, we'll be talking about methylphenidates Ritalin. Most of you that have got family or relative or someone quite close to you that suffers from attention deficit hyperactivity disorder, which is popularly abbreviated as ADHD, would be familiar with this medication, methylphenidate, because it's a drug of choice in managing this disorder. But what I'm about to say now is a bit tricky, and the reason why I chose this medication to discuss this. If you look at ADHD symptom, you've got insomnia there. ADHD patients are often hyperactive, unable to settle on sleep. So insomnia is a symptom of the disorder. And if you look at the side effects of methylphenidate, you've got insomnia there as well. So what it means that if you are using methylphenidate to manage ADHD, that there will be synergism and increased or intense insomnia. So the counteraction that I would suggest here is, if you have this disorder and you're using methylphenidate for it, work around with your healthcare professional so that you ensure you take the exact dose that can manage your condition, nothing extra. And if it's something you can work around other alternative, that could be awesome as well. So the third class of medication we'll be talking about today is the oral or nasal decongestant. An example is the oxymetazoline or pseudoephedrine. And this class of medication can cause insomnia simply by the symptomatic effect. And the counteraction that you could take is to opt for antihistamine, or a total awesome one, the likes of saline nasal spray, which is a drug-free option. I've got one here. This is saline nasal spray. It is awesome in decongesting your airway if you've got cold. And the fourth class of medication that could deprive you of your sleep that we'll be talking about today is the corticosteroids. Example is the methylprednisolone. And this class of medications are useful in managing inflammatory conditions. And how do they interfere with sleep? By their very mechanism of action, they model with the corticosteroid hormone, and the level of corticosterol in the body increases. And when the level of corticosteroid increases, it comes with restlessness. And when one is restless, we all know it is difficult to settle and fall asleep naturally. And what counteraction can be taken to address this? You could explore other options such as using NSAIDs, thus the non-steroid anti-inflammatory drugs like diclofenac, ibuprofen, naproxen, to manage the inflammatory conditions. But for those that are also patients, they should be cautious because it can worsen ulcer condition. You have to work around with your healthcare professional to see if that suits your condition. And the fifth class of medication that could cause sleep impairment that we'll be talking about today is the beta blockers. Example is the carvedilol. This class of drugs are used to treat blood pressure and at the same time arrhythmias. And how do they work? This class of medication depletes the sleep enhancing hormone known as melatonin, and if this hormone is depleted, it makes it even more difficult for you to fall asleep. So what counteraction can be taken? If it's possible, you can swap to a total different class of drugs such as calcium channel blockers, example nifedipine and amlodipine, or alternatively a supplement of melatonin can be added to your medication to provide an external source of this hormone. And the sixth medication class that could cause you insomnia we'll be talking about today is the statins. The simvastatin, atorvastatin, the Lipitor. This class of drugs are very helpful in controlling our cholesterol level and at the same time reducing the risk of heart diseases or heart attack. But by their side effects of causing achy muscles and cracky bones, they can keep you in pains, restless and awake, thereby interfering with your sleep. So the counteraction that can be taken is for a painkiller medication to be prescribed to address the issue with your muscle aching, or the benefit of both medication thrown on a balance, because trust me, if you are sleep deprived because of you are at the risk of heart attack over a long period of time, the heart attack could happen. So I suggest that it should be thrown into a balance and weighed with your healthcare professional so that you all could model out what will work for you better. And the seventh class of medication that could cause insomnia that we'll be talking about today is the ACE inhibitor. That's the angiotensin converting enzymes inhibitors. Example is the lisinopril and also angiotensin receptor 2 blockers. A typical example is the voxetan. And how do they interfere with your sleep? This class of medication have got the side effects of hacking cough. You could cough all day and all night if you're having the side effects from either of this class of medication, and this could interfere with your sleep. And also this class of medication can result to a condition called hyperkalemia, because of the increases the level of potassium in the body, and the condition hyperkalemia can be associated with bone aches, and extreme condition could even lead to paralysis. And how can you counter this? Work it out with your healthcare professional. Calcium channel blocker, amlodipine and nifedipine could be a good swap. And the last but not the least class of drug that could cause insomnia that we'll be discussing today is the thyroid hormone replacement. That's the levothyroxine. We all know that the symptoms of hypothyroidism comes with being sluggish, drowsy and sleepy. But when you replace your missing thyroid hormone with medications such as levothyroxine, that can interfere with your sleep. So the counteraction to take is for you to review the dose. If you are on levothyroxine for your hypothyroidism condition, the dose should be reviewed. And also, we are done with the 8 classes of medications that we consider major or rampant that could cause insomnia. So I would just enumerate 4 counteractions that you and your healthcare professional can take to balance it out or counter the effects of you not having enough sleep because of the medication you are taking. The very first counteraction step I recommend is for you to be swapped to an alternative medication where possible. If there is an alternative medication in the same class that can treat the same disease condition with minimal or no interference with your sleep, you should be swapped to that. And the second counteraction that can be taken is review and have the dose of the medication you are taking adjusted. And the third counteraction that I'm proposing that you could work out with your healthcare professional if you are not taking any medication within this 8 class that we discussed would be to have a supplement such as melatonin added to your medication so that you can still have that sleep. While if you are taking a medication that depletes the melatonin level in the system. And finally, the 4th counteraction that you can work out with your healthcare professional is to put the pros and the cons on a balance, on a weighing balance, and weigh the risk and the benefit out. If you're taking a medication that deprived you of your sleep, what you are taking that medication to address, is it worth your sleep? That's a question left for you and your healthcare professional to answer, so that everything get balanced out, you get enough sleep that you deserve, and your other healthcare condition that requires to be managed appropriately get that attention as well. I hope I've been able to crack the question. Thank you all for your support, and see you next Wednesday. Bye bye.